Hello, in this brief video, we are going to discuss about blood clot reported after COVID-19 vaccine and the reasons. Blood clot was reported as an unexpected adverse event after receiving COVID-19 vaccine, specifically AstraZeneca and Johnson & Johnson. But this blood clot has been occurred with both DNA and RNA vaccines. AstraZeneca is an RNA vaccine and blood clot has been reported in Canada and Europe Economic Area. In United States of America, Johnson & Johnson DNA vaccine has resulted in blood clot. This has been reported mostly in females between the age of 18 to 39, and it has resulted in cerebral venous sinus thrombosis, otherwise known as CVST. This has been reported on an average 2 weeks within vaccination. And the blood clots has resulted in low platelet counts and stroke. Now, FDA has reported that after Johnson & Johnson vaccine, thrombosis with thrombocytopenic syndrome has been reported, and this has been reported in women younger than 50 years. FDA says that the benefit of vaccine still outweigh the risk, and women younger than 50 years who are getting Johnson & Johnson vaccine should be aware of the risk. Now, scientists at Brown University, in collaboration with the American Heart Association and American Stroke Association partnership, they studied CVST, cerebral venous sinus thrombosis, from COVID infection versus COVID-19 vaccine. The study reported that there is 8 to 10 times higher risk of CVST from COVID-19 infection compared to COVID-19 vaccination. So they advise that anybody who is able to get one of the vaccines, they should get the COVID vaccine to avoid the increased risk of CVST after COVID-19 infection. Now, what are the reasons? Studies have been done in Germany with AstraZeneca vaccine, and they say that viral vector vaccines are responsible, or they are the ones which is causing the blood clotting. They studied AstraZeneca vaccine. They identified around 1000 proteins in the AstraZeneca vaccine preparation, which are stray proteins, and they also found that the preservative was EDTA. When EDTA is a preservative, they allow these stray proteins to penetrate into the blood and cause autoimmune reaction. This once inside the blood, these proteins bind to the platelets and clot the blood clots, and this leads to the low platelet count and stroke. And this was the mechanism. And thank you for listening to the video, and stay tuned for other videos later.